Welcome to the Pediatric Critical Care Fellowship at OHSU Dornbecker Children's Hospital. My name is Erin Burns and I'm the Fellowship Director here. I'd love to give you an overview of our program in place to complement your interview day with us. This is intended to add to the information on our website as well as the informal open house sessions that we host for prospective applicants with our fellows and program coordinator. Let's start with a quick high-level tour. Dornbecker Children's is a breathtaking building that sits on stilts on Markham Hill overlooking downtown Portland, Oregon. The building originally opened in 1998 and has won several awards in the engineering and architectural world, so it's worth noting in and of itself. Here is a view of the western facade of the hospital to give you a better idea of its size and configuration. There's a lobby at the base, and then 4 long floors of clinical space above. The smaller windows along the bottom are the 7th floor, housing our ambulatory clinic spaces, and just above that is the 8th floor, housing our PICU and operative suites. And these connect seamlessly to the University Emergency Department and PDD and imaging facilities. Zooming out a bit more, you can see Dornbecker again, this time from the eastern facade. And as you can see, it is a freestanding children's hospital housed on a larger university campus. In the background to the right, you can see downtown Portland and some of the many bridges that define Portland's history and geography. In terms of size and volume, our PICU has 20 beds but can surge up to 25. The 20 bed spaces are arranged in a large rectangle around a central med and supply room with an adjacent clinical workroom for providers. Within this clinical space, we care for patients on 2 services: the med surgical or general ICU service and the cardiovascular ICU service. Our annual volume is approximately 1,500 admissions, which include about 1,000 critical care transports, 150 patients who have been on cardiopulmonary bypass, and roughly 15 to 20 VA and VV ECMO cases. The clinical breadth of our patients includes exposure to a large number of bread and butter pediatric ICU cases, including medically fragile and technology-dependent patients, and also a fair number of zebras. Our fellows become adept at managing ECMO, oscillatory, and other less common modes of lung protective ventilation, continuous renal replacement therapy, and bone marrow transplant complications. Kidney transplants are currently the only solid organ transplant population that we care for, while our fulminant cardiac and liver failure patients are sometimes referred to transplant centers along the West Coast. Our diverse patient mix stems from a very large referral area extending from southern Washington to northern California and east to the Idaho border. This vast area offers great geographic, cultural, and socioeconomic diversity. The orange dots on this map represent all of the PICUs in the Pacific Northwest region. The size of our catchment area makes for some complex patient transports, and for this we rely heavily on our specialized pediatric and neonatal critical care transport team, known fondly as the PANDA team, who perform long and often complex transports to our center 24/7. This team is comprised of an outstanding group of PICU and NICU trained nurses and respiratory therapists who are among the best in their fields and absolutely wonderful to work with in the context of online medical control and transport direction. Our fellows spend time with this team longitudinally over their training. Our amazing faculty are pictured with their backgrounds and interests on the PDF info sheet you also received. We have a really strong and collaborative group of clinical educators, including 3 cardiac intensivists who train our fellows. Additionally, many other wonderful faculty support our fellowship through the Heart Center program. We have 3 wonderful cardiothoracic surgeons who perform about 300 open heart cases per year, with about half of those utilizing bypass. And when they're not operating, they're actively engaged in our fellows' education, including participating in weekly teaching conferences. While the CVICU service shares a physical space in our PICU, the service operates independently in terms of having dedicated nursing staff, quality, and administrative support. Our PICU fellows share coverage duties of the CVICU service with the pediatric cardiology fellows. Our fellowship program has been thriving in this clinical environment for over 10 years. All of our graduates since 2015 are thriving in a variety of practice settings, though the majority are academic. All of these alumni to date have passed their critical care boards on their first attempts. Our PICU fellows spend a majority of their time caring for the patients on the medical surgical PICU service. They additionally have 3 other ICU experiences, including the CV ICU in our unit, the CV ICU at Seattle Children's Hospital for 1 month, and 1 month in the OHSU Trauma ICU. All of this clinical experience is well balanced with protected research time. A sample block schedule can be found on our program website. Here is the overall structure of the 2 services that exist concurrently in our PICU. The teams are completely septated in terms of fellow attending NP and resident coverage during the days, with a single coverage team at night. Rounds occur sequentially twice a day to allow for various consultants to be present. As is true of the vast majority of PICUs with fellowship programs, attending coverage is in-house 24/7 to provide direct teaching and supervision. Our fellows work day or night shifts in variable stretches of 4 to 7 days or 3 to 4 nights. Thursdays and Fridays each contain 2 to 3 hours of protected didactic time, which means Wednesday and Thursday night shifts are without fellow coverage to allow for maximal learning. The fellows have a large amount of control in determining their schedules each year. Other clinical rotations are variable in terms of their clinical loads and expectations. The trauma ICU rotation at OHSU and the CV ICU rotation in Seattle are the only other rotations where occasional night shifts exist. I'd also like to highlight some of the longitudinal training experiences that don't fit neatly into a block schedule. The first is exposure to our Pediatric Critical Care and Neurotrauma Recovery Program, one of the few multidisciplinary PICU follow-up clinics in the Western United States. Fellows will identify patients with neuroinjury that they've cared for in the PICU and follow these patients at their 3- and 6-month follow-up visits. It's an amazing way to see PICU outcomes firsthand and learn about the sequelae of post-intensive care syndrome. Our fellows also spend time with the critical care transport team at several intervals over their 3 years, allowing them firsthand experience with transport logistics and how the teams can partner with referring facilities to stabilize a child. Point-of-care ultrasound training also occurs longitudinally as hands-on teaching in series each year, such that our fellows become facile with lung and cardiac imaging in addition to traditional vascular uses. Lastly, the Dornbecker SIM program organizes 1 to 2 team-based in situ simulations per month to keep the PICU team functioning in a well-oiled and collaborative manner, and fellows regularly participate in these when they're on service. While soaking up a rich clinical experience, it is essential for our fellows to have regular dedicated didactic learning and opportunities to teach. Starting at the PICU divisional level, we have weekly case conference to review all admissions in the prior 7 days, focusing on difficult or challenging clinical scenarios. Fellow-level didactics occur on Thursdays and Fridays each week, and on a monthly basis, we have our unit QI meeting and PICU M&Ms, as well as monthly evidence-based medicine sessions and core physiology. Prospective fellows often want to know about the opportunities to get involved with teaching in our program, so I've summarized a few of them here. The most proximal is a lecture series for residents and students rotating in the PICU, and fellows share these teaching duties with faculty. And then there are many forums through the Department of Pediatrics and the residency program, as well as through the schools of medicine and nursing. Also, many of our fellows choose to become PALS instructors through the PALS instructor training program at our SIM Center. For fellows who are really interested in making education a focus of their career, or who really want to hone their teaching skills, our graduate school offers a year-long seminar called the Education Scholars Program, which is an optional course meeting weekly in the evenings for about 2 hours and covering topics from adult learning theory to how to manage difficult or struggling learners and how to build a safe learning environment. And it also focuses on educational scholarship and how to do it well. Speaking of scholarship, I'd like to transition to talking a bit about our research curriculum. As of right now, every PICU fellow in the country, unless they're doing a second fellowship, is required to have a scholarly work product at the end of training in order to sit for the critical care boards. And so we need to make sure that our fellows are well supported and well positioned to accomplish this. More than a third of our fellows' time in fellowship is dedicated to learning and completing their research with the aid of strong mentorship options available within and external to our PICU division. Formal research training comes via our Human Investigators Program, or HIP, which we are really excited to be able to offer to all pediatric fellows. It's a 2-year curriculum orchestrated by the Oregon Clinical and Translational Research Institute, or OAKTRE, and it opens up lots of doors in terms of mentorship, networking, funding, and other research supports. All pediatric fellows are able to enroll in this course free of charge, which grants them a certificate in human investigations after 2 years, with an option to turn that into a master's in clinical research or master's of public health with completion of 3rd year coursework. So I realize I have thrown a ton of information at you, erring on the side of over-informing so that you have as much useful info as possible. But I'd also like to share with you a bit about this wonderful place and the people in it. If you come and join us here at OHSU Dornbecker, you could literally have this view every day. You can ski this mountain on weekends, and you can ride this gondola in the foreground, which we call the aerial tram, to and from work. And you can thrive in this beautiful city, a safe, welcoming, and diverse place to live and work and grow. All 4 quadrants of the city are popular places for trainees and faculty to live, each with their own character and personality. I encourage you to ask about the city during your interviews or when you visit with your fellows at their meet and greet sessions. Our fellows are simply happy and healthy because they support and care for each other, which is so essential in a small program. Our fellows and faculty work hard and play hard. Our fellows are part of a larger faculty group that truly functions like a family. We work hard because we love what we do, and what we do is important to the kids and families in the Pacific Northwest. I am so proud to be a part of this team, and we are so excited to welcome new team members each year who get as jazzed about teamwork and continuous improvement as much as we do. Thanks for listening, and we hope you enjoy your time meeting with us.